Imagine this. A patient comes in with stomach pain. At first, it feels vague, uncomfortable, hard to locate. But hours later, the pain becomes sharp, intense, and very specific. This is how acute appendicitis usually begins. The appendix is a small, finger-like pouch attached to the large intestine on the lower right side of the abdomen. For years, people thought it had no real purpose. But when it becomes inflamed, it becomes one of the most important organs in the emergency room. Appendicitis almost always starts the same way. The inside of the appendix gets blocked. This blockage can be caused by stool, lymphoid tissue, parasites, or rarely a tumor. Once the appendix is blocked, bacteria inside it start multiplying. Pressure builds up. Blood flow decreases. Inflammation begins. At first, the pain is not in the right lower abdomen. This is very important. Early appendicitis causes pain around the belly button. Why? Because the early inflammation irritates visceral nerves, which the brain cannot localize well. So the pain feels central and vague. As the inflammation spreads and irritates the peritoneum, everything changes. The pain moves. Now it becomes sharp, localized, and intense in the right lower quadrant of the abdomen. This migration of pain is one of the most classic signs of appendicitis. Soon after, other symptoms appear. Loss of appetite is almost universal. Nausea and vomiting follow the pain, not before it. A mild fever may develop. If you press on the right lower abdomen, the pain increases. If you suddenly release your hand, the pain becomes even worse. This is called rebound tenderness, and it means the peritoneum is inflamed. As hours pass, the appendix continues to swell. If nothing is done, the blood supply can be cut off completely. The tissue starts to die. This is when the appendix can rupture. A ruptured appendix is dangerous. Bacteria spill into the abdominal cavity. This can cause peritonitis or abscess formation. What was once a simple surgical problem becomes a life-threatening infection. This is why appendicitis is treated as an emergency. Diagnosis is based on a combination of things: the story the patient tells, the physical examination, blood tests showing infection, and imaging, usually ultrasound or CT scan. There is no single test that diagnoses appendicitis perfectly. It's a clinical diagnosis first, supported by investigations. Treatment depends on timing and severity. In most cases, surgery is the definitive treatment. The appendix is removed before it can rupture. In selected cases, especially early or uncomplicated ones, antibiotics may be used. But surgery remains the gold standard in many centers. After removal, patients usually recover quickly. Most people go home within a day or two. Life continues completely normally without an appendix. The key lesson of appendicitis is timing. Early recognition saves lives. Delays increase complications. So remember this simple pattern. Pain that starts near the belly button. Pain that moves to the right lower abdomen. Pain associated with loss of appetite, nausea, and fever. That combination should never be ignored. Appendicitis is common. It's dangerous if missed, but when recognized early, it is one of the most treatable surgical emergencies in medicine, and that's why understanding this simple condition can make a huge difference for patients, for students, and for anyone who wants to recognize when abdominal pain is no longer just stomach pain.